Hi, everyone. I'm Anand Iqbal, and welcome to another awesome episode of Digital Health on Air. Today, we're joined by I should say, Dr. Adam Glasofer, and I'm super excited for this conversation because his experience runs the gamut in healthcare. He has worn every hat and has seen healthcare from a variety of different lenses. From his work as a chief medical information officer, as one of the first chief innovation officers, kind of as before that was even a very common role, a practicing pediatric hospitalist at some of Philadelphia's most prestigious health systems, to a global healthcare strategy leader at Amazon Web Services, and to now founding Vertex Health. So super excited for him to share his unique perspective. He's really an ideal leader to share what's exciting in healthcare today. And as we look forward to kind of not just end of the year, but into 2026, he is a proud Eagles fan. So you can see little Eagles love in
Yeah.
his background there. He's
You'll
congrats
see
on
all
being
sorts of Philly sports Easter eggs in the background. So for better or worse.
awesome. Well, we're super excited to have you, Adam. Welcome, welcome, welcome.
Thanks for having me.
Of course. All right. So we'll just kind of dive into it. You've been involved at the intersection of medicine, innovation, and technology really since the very beginning of your career as a physician. What kind of sparked your interest to come to this confluence of excitingness, but also craziness? Would love to just kind of hear the backstory.
Yeah. I always liked technology, even as like a small child, whether it was, dating myself, like like our new Atari or, Nintendo, or whatever the new technology was, I always loved it. And when I was in training, so I did my pediatric training at what's Nemours in Wilmington, a pediatric hospital, and we had electronic order entry. And just there, I saw some opportunity to like streamline things and make it better. And I volunteered and built some order sets. Very very basic, but we're talking, oh my gosh, 2005, something like that. So a while ago. And then when I left and joined, a health system as a pediatric hospitalist, it was all paper orders. And I had actually never handwritten an order outside of an ICU before. So these full kind of order sets. And I found myself very quickly volunteering my time and wanting to build out the order sets as they moved to electronic ordering. And really, that's how I got my start. And from there, the kind of just gradually progressed to from order sets to building out telehealth to deploying EHR and voice tech and Center for Innovation. So it was really very gradual. Honestly, I wish I had like a more exciting story, but it was really just making EHRs easier to use is how I got my start as a resident, just seeing opportunity.
Well, look, one, thank you for your leadership in the early days. And that experience, I'm sure, is still very relevant and impactful today as we think about providers and interaction with technology, especially the EHR. So, I mean, you began working at this intersection back in the early 2000s and the 20s, just as health IT innovation really started to become a thing and really began to boom. What change or technology innovation have you found the most exciting as you look backwards? We'll talk about looking forward here as well, but like just what's been most exciting for you and most impactful in your opinion?
Yeah. Again, I'll probably give a bit of a boring answer, but I do all sorts of cutting edge work, whether it's technology or science, in the different areas that I sit in. But I think for me, the most impactful thing that I've seen over that time is the recognition that EHRs, which by the way, were created to capture data and bill. That's how they were built. No clinicians, no people delivering care, no nurses, no one in the care delivery spectrum was involved. It was to capture data, get billing. I think for me, the thing that's been most exciting is to see the realization that we need to make these tools more than they were built to be. And we need to reduce the friction, not just on the care team's end, but also on the patient end. And I think there's been a ton of innovation in that space. Have we stuck the landing? Definitely not. But I mean, light years beyond where we were, at least when I started there. So, I think as organizations, an EHR is one of the single biggest investments that a health system will make. So, sometimes it surprises people where, when a startup point solution comes in and the first question will be like, well, can Epic do that? If Epic can't do it, well, can it integrate? And so like the recognition that there are these tools that are that are important, but like we can make them better to, not just, yes, burnout is key, improving things like that, but actually just streamlining efficiencies, bringing knowledge, the AI boom has kind of brought that to the forefront, just bringing that to the front line has such great impact on everyone. So I think we're moving into that phase of really next level where like we're beyond the realization and now we're really optimizing what that experience could possibly look like.
Yeah, awesome. Look, not a boring answer at all. I think this is a very real answer. I think it's actually a great reminder for all of our listeners and for all of us that the EHR was intended for a certain set of things. The EHR is now asked to or expected to do far more. Help us tease out, especially, as a provider, as someone who works with providers from the variety of different seats and hats that you've held. Is the EHR the right solution, or should we be thinking about what comes in and around it to really deliver what's needed for the providers, for the care teams, for staff, and ultimately the healthcare consumer?
Yeah, that's a loaded question.
Well, I
Well,
don't want to get you in trouble, but go ahead.
no, I know I'm not going to get in trouble. No, I mean, look, EHRs are what they are. There's really no going back. So it's all about looking forward and how do we make it better. And I think, it's important to certainly keep that mindset as we move on that. But there's tremendous opportunity in having that as an anchor, right? Like
Mhm.
knowing that that's what's going to be there, and then understanding all of the potential offshoots that we can come out of it. Is it always the right answer to integrate a point solution into the HR? No, but my tenant. So, I have a background in informatics, so like geeking out on end user clinical workflows, like that's how I got my start. So I think you always need to keep in mind, is the gain worth the pain? Because for
Mm.
anyone that's delivered clinical care or been involved in a care delivery workflow or working like back end asset management, when I say care delivery, I'm not just talking about like the frontline clinical staff. I'm talking about anyone that's touching that EHR, involved in that continuum, and it is painful. So if you're integrating, often it's less painful, not always. If you're existing outside of the EHR, it's definitely going to be more painful because it's often
Mhm.
outside of the workflow. So you need to see tremendous gains to overcome those types of things. Bit long-winded answer, EHRs are here, and I think it's about going case by case to determine what's the best integration point or use of a augmenting technology for the frontline users.
No, thank you. I love this. Look, again, I think you started off with the right set of reminders of what the EHR was set out to do. The reality that it is the backbone or a core part of a health system's kind of operating uh, rhythm, and really, it's a key piece of the health IT stack. Gain worth the pain. Like, I love that framing, right? I
Yeah,
think oftentimes folks just forget about that, right? That it's not just about technology. It's not just about, well, I should say it's not just about a problem, solution, and technology. It's like, okay, like how are real people going to use this? And there's going to be pain. And is what you're offering really going to outweigh any and all pain, or can you minimize the pain by working with the EHR? So I love this. I know we hear EHR first all the time, but there's real health system leaders trying to solve very real problems, and they know what they're going to get with their core health IT stack, and they're looking for more around it, but gain worth the pain is the right framing.
yeah.
I love it.
And you got to just keep those workflows in mind. I mean, I've met with thousands of startups in my career, and you would think even some that are somewhat advanced, you hear the pitch, and then in my head, I'm like, no one is actually going to use that the way that you've designed it. So like,
Totally.
it seems incredibly obvious, but not always executed well.
Awesome. Okay, this is a perfect segue. You were the first Chief Innovation Officer of Virtual Health. That role, Chief Innovation Officer, will vary from system to system. And I think over the past decade, we can say like it has meant different things. If you think of kind of where healthcare is today, now that health systems know how to purchase and evaluate software, as they think about workflow automation, think about what they do with their EHR and other systems around it, right? The role is more common. There's a big focus on innovation across all sectors of healthcare. Like, how do you think that chief innovation officer role is really improving healthcare delivery at a broader scale?
I mean, you alluded to it. There's a wide variety of what that role actually is. And I think it depends on the organization. I think the fact that it's becoming more widely adopted is great. But I think the question is, what's the organizational commitment to
Mm,
innovation? And
mm,
um, is it innovation theater, which like, we've all heard about, where it looks good, it's shiny, it's fancy, but like, is there really like back end commitment to building a culture of innovation that's going to drive these things forward to actually bring about patient impact and outcomes and things like that? And then you have organizations that really, really double down on it. So I think you see a wide variety, but at the end of the day, organizations know that they need to innovate. So having someone whose full-time job it is to do that is critical if you're truly committed to that. Because if it's a part of someone's job, it's not going to be executed to the way that it needs to make true enterprise level impact.
I'm like, you're just dropping the realness, and I love it. No, it's great. look, I think as someone who's, as someone who's often on the other side working with chief innovation officers, we really look to identify, you know, who has real full organizational commitment and candidly, right, the budget and the influence to make real investments and to stand behind, right, whatever change, again, gain worth the pain. Like they've identified this is a gain and it's worth the pain, but they're going to stick by it versus those who are like, this is just, like a next America's Next Top Model or whatever, right? It's really innovation theater. It's just showing off the new bright, shiny stuff. So I love that framing again.
And I do want to be clear, like in the instances of innovation theater, that's not necessarily the fault of the chief innovation officer.
Totally.
I think finding the ideal person, they've got true autonomy and true authority. And going back to what you were asking, so one of the things when my team at Amazon, we ran this AWS Healthcare Accelerator, we would kind of work backwards from customers to source, all right, what do we want to focus on? And we would ask a standardized set of 5 questions to figure out, all right, we're going to invest in this program and these companies that we bring in. How do we maximize impact? And I would say the most important question we ask, which goes exactly what you're saying, is what's the biggest problem that your organization, we were talking to health systems around the world, has approval to fix, money to buy, and people to implement, right? So like all 3 of those pieces are critical. And when looking for the right partners, I'm sure you guys are, those are the key parts. Do they have the backing of the org? Do they have the money? And do they have the people, which by the way is very often overlooked.
Absolutely. Absolutely. This is awesome. Like super real, super practical. Let's talk about Vertex. So you just celebrated your 2nd birthday. As you look back at the past 2 years, someone who started their healthcare technologist journey 20 plus years ago, right? Like what's been surprising in your work with health systems and healthcare leaders in the past 2 years?
I think what's most surprising to me is while I think we're getting more creative at finding solutions, the problems are almost the same as they've been for the last 20 years. Like there's varying levels, but if you talk to organizations, they're still, how do we reduce length of stay? How do we lower costs? How do we capture more revenue? How do we prevent patient leakage? Like there are these yes, there are like a wide variety of things around that, changing payment models, but the end of the day, those are like the core kind of issues. And I don't think they've changed all that much. So I think, in that regard, like those are all things that have major, business impact for health systems and organizations. So if, there's tremendous opportunity, if you can find a problem somewhere along those things and you can solve it, you can often create a pretty good business case to come in and work with health systems. So I think it's kind of like even though we've seen tremendous rates of change and pace with like AI boom and all their tech, the problems are relatively similar as they have been.
Yeah, no, heard. Absolutely heard. I think we often joke that we use fancy words now like access and the healthcare consumer, but when we launched the company 10 years ago, it was about just simple scheduling, like getting people into the care they need when they want to get it. And now we use words like access and the healthcare consumer, but the core problem
prevents
statement,
patient leakage and builds brand partnership. Yeah, all those things.
Absolutely.
100%.
Yeah, it's the same core pain point. Okay, let's look forward. You're in your seat today at Vertex, but you still wear a variety of different hats. You partner with the AMA, like thousands of startups, like you get to see kind of anything and everything. What do you get most excited about, like being in healthcare today? And how is it different than, I guess, help us parse out the nuance from the different parts of healthcare that you see and touch.
Yeah. Well, I think I'll give kind of a general answer, then I'll give a very specific tech answer. I think what excites me the most are the people. And I think just really inspiring seeing people from all segments, whether they're clinicians, whether they're administrators, operators, patients, patient advocates, just all of these different groups trying to make change at scale to improve not just health outcomes, but just even the experience. And I think for me, that's been a large part of how I choose what I work on at this point, right? Like I say I have my 1A and 1B. 1A is people. Like I like to work with people that I like and are good to work with and are hard workers and are trying to do important things. And then B is the mission, right? The mission really needs to be important. And what's the impact? I just am continually jazzed by the people that are in this space trying to make impact for change. I think the tech answer I'll give to this, and this is like always a running joke in different areas I'm a big AR VR guy. And we did some piloting of the technology back when I was still in the health system, which was over 5 years ago at this point. And I thought it then, and it's still the case now, where, the technology is almost ahead of where we are from an adoption standpoint. But I am so bullish on the integration of really specifically augmented reality into the delivery of clinical care. And there have been some great players in the space. But for me, I just always like to see those use cases, especially when they're actually integrated into care delivery workflows.
Awesome. Look, I think you've given
I didn't
fantastic,
go
like,
with AI, by the way.
and hey, I appreciated that. You did not join the hype train. There's been fantastic, like, there's some amazing nuggets in here throughout our conversation, especially for those who are looking to solve real problems in healthcare. A large part of our audience here is our health system leaders, right? Think CIOs, CMIOs, marketing leaders, revenue cycle leaders, access center leaders. Your advice to them, as you've been in their shoes, right? You're often advising them today, but for the broad audience here, like, just your advice to them as they're dealing with, the realness of all the complexity, the labor shortages, reimbursement challenges, an evolving consumer, evolving technology. Like, just you're like, I think you're gonna give it to us real and straight. Like,
Yeah.
just what's your advice to folks who have to go solve real problems today?
I mean, as someone that really sits in the startup ecosystem, I think it's, being open-minded to startup solutions
Mm,
as something that can really impact change in an organization. Now, and I'll give the other side of it too. It needs to meet a business case without a doubt, right? Sure, I would love to implement AR all over the place, but it doesn't always meet a business case. But I think considering that really can drive change for an organization. On the flip side of that, one of the big things that I always work with startups on is, having sat in that operational side of a health system, right? Is startups really need to be super crisp in delivering, what it is they do, what problem they're solving, what the ROI and business case is, and make it incredibly easy for the person they are pitching to not only understand it, because at the end of so I used to make a joke like, assume I'm a moron, which I might be, and just spoon feed me all of this, because at the end of the day, when the startup leaves, you're relying on me
mm,
to pitch your solution. So you better make it really easy for me to just walk over to someone and be like, hey, I just met with this company. They do this and would fix this for us. And this is what it would cost. And here's what it would make or save us. Which again, it sounds incredibly obvious, but it's executed poorly sometimes. And I think if that messaging was passed along sometimes in a bit more of a compact fashion, it would be far better received. And I think, some of what I started with, where I, consider startup solutions, there might be more consideration for some of those earlier players.
yeah, no, preach, my friend, preach. Like,
Yeah.
again, our 20 minutes here already have been chock full of really, really impactful and super relevant reminders for all the different players in this space. I'm going to go a little off script here, but I know you
Is
and I
it,
have chatted
is
about
this
this.
the,
So
is this the Philly sports part of the
this is not the Philly
conversation?
sports part. This
Jeez.
is not
Okay.
the
I
Philly
was ready
sports.
for that.
You and I have chatted a lot about how health systems in different countries do things, and the problems they're looking to solve, be it the UK, be it Australia, New Zealand, be it parts of Africa, the Middle East. Like, as you've spent time partnering with and advising and just learning from healthcare leaders in those geographies, are there things that you think we should be applying here in the U.S. and vice versa? Are there things that we'd get right here that we should be articulating to um, in that moment where, like, assume I'm a moron and you need to spoon feed me? Are there things that we should be communicating to our health system partners in different parts of the world?
Yeah. Um, Listen, I think to sit here and say that, we are the best in the world at delivering healthcare or integrating technology, I mean, we know that we're not. So I think it's like pretty
Mm,
easy. So, I mean, that being said, we can learn from pretty much any country, right? The challenges in different parts of the world are definitely different. Depending on how your health system is structured, right? Where you've, got it more, public systems like in Canada or in the UK. And look, there are challenges in those that we can bring in. How do you when you have publicly available healthcare, how do you verify that the person that's in front of you is who they say they are to combat fraud, waste, and abuse? And we know that's a problem in this country as well. And then you look at other countries that have less developed infrastructures, and access is a problem. How do you
mhm,
reach people that don't have the same level of access to technologies? I mean, I've seen some super compelling startups and tech solutions based on like flip phones,
mhm,
normal, old school phones, because that's what they need to do. So I think there's a lot to learn from the creativity of other countries and other regions and how they find people and how they, help to reduce the friction of delivering care. I think the other thing that always fascinates me is, where I think there's always opportunity to learn from anywhere is, in almost every country, right? Your highest utilizers are often groups that they're hard to engage with, right?
Hmm.
So how do you find people that don't necessarily want to be found? And how do you help them? And how do you do that in a way that feels comfortable and responsible to like try and impact care? So like those are the things that I find super, super compelling. And I think there's some countries that have done really interesting jobs with that and others that, less so.
Awesome. Adam, this has been awesome. Like, thank
Yeah, this
you.
is great.
I always leave every one of our conversations feeling a bit smarter, but definitely more challenges. So like, oh crap, why wasn't I thinking about that already? So thank you for doing that for me, but for our broader audience here. This has been refreshingly real, which is I think very much needed given where healthcare and healthcare technology is today, and especially as we look forward to 2026. Like the realness and the reminders here have been super super spot on and impactful. So thank you.
Well, thank you. I have never been accused of not being real. I always try my best. And thank you for having me. I'm happy anytime. I always love when we chat.
Awesome. All right, Adam. Thanks so
All
much.
right.
Thanks
Take it
everyone.
easy.
We'll see you next time for another episode of Digital Health on Air.